Hi, I'm Dr. Larry Conley. I'm an orthopedic surgeon at Edisto Orthopedics and Sports Medicine. I was in the military for several years as a medic, and that was really a confidence builder. I worked with several PAs or physician assistants and initially went back to school to be a physician assistant. I served as a physician assistant for 4 or 5 years and then decided I was going to go back to medical school. I had an older brother who was an orthopedic surgeon, and he was a big motivator behind that. I went to medical school at Des Moines University. That was a 4-year program, and then that was followed by a 5-year residency and internship in Michigan. The thing I like best about my job is the variety of doing a general practice. We really get to touch on a lot of the most common disease processes to do with muscle, bone, joint. Fortunately, I get to work from the shoulder down is what I tell everybody. So we do everything from joint replacements of the hip, the knee, the shoulder reconstruction, sports medicine, fracture care, or everything from broken arms and legs to replacing the joints around them. I like building things, I like repairing things, and to see somebody come into the office and they can hardly walk or they've got to use a wheelchair or crutches, to be able to make a difference in that the next time they come in they don't need those things is a really big motivator. My practice philosophy is really bringing the patient into decision making. I'm never going to walk into a room and tell a patient that, wow, you've got to have surgery right now. There's a lot that goes into that decision, and there's a lot of people out there that have problems that don't necessarily need surgery or respond without surgery. When those simple things fail, if it's a quality of life issue, then we can surely talk about a surgical remedy for that. I'm relatively conservative up to the point of what the patient's needs are going to be.